Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini. Welcome all.
All right, today's topic. I think it's a good one, Doc. I don't know about you.
I definitely do. I think it definitely requires conversation and awareness.
So our strong title for today is the adjustment assembly line. Are you practicing or producing? Bum, bum, bum. What is this all about anyway? So when we were thinking and considering about this topic, we both thought it was a good one because I think some doctors certainly can get sort of comfortable in the repetition of doing the same thing every day, all day, right? The familiar. We gravitate towards the familiar typically, don't we?
Oh, absolutely. And we spend so much of our energy sometimes getting there that we don't recognize that maybe in many ways by losing some of that individuality in a sense, we almost make ourselves bored with what we're doing.
And I can see the trap there. So from my background, my professional background, which includes massage therapy, I have gone and gotten massages in places where one, they don't ask me anything besides where do you want me to focus on, get on the table, or I get a nice thorough, history and informed before I consent. But then I feel like they didn't actually adjust anything, like as far as their technique or what they were doing. It felt like, well, why did they ask all those questions? Because they're just doing what they do. You know what I mean?
Yeah, we really focus back down onto the age-old thing that Jim Parker used to always say, and that's present time consciousness, the PTC. It doesn't matter how many people you see or don't see in a day. What matters is whether every single one of them is getting your undivided, focused attention.
And not only that, are you adjusting to your patient's needs? Pun intended. Right?
But we did a podcast with Dr. Heidi Havoc, and she mentioned in the middle of that how they're having evidence that we actually can transmit, for lack of a better term, a healing energy that affects the nervous system just by being with these people, certainly by just putting your hands on these people. But she was also very clear in making it known that you have to be focused on what you're doing and who you're doing it with.
So let me ask you a question, Doc, because you do a lot of medical malpractice defense work. Where does this fall in line when we're talking about somebody who's just repeating themselves daily, constantly?
Well, they do exactly what I just said. They lose their focus. They're just going along, plugging along, and everything's great. Busy day, cranking out the patients, and they're not thinking when they need to stop and think. So all of a sudden, in the middle of your big busy day, the one patient comes in, this happened and that happened, and rather than taking that moment of to stop and think about what that patient's saying, you're more focused on keeping the flow going in a sense. So somewhere along the line, there has to be this balance between seeing as many people as you want to see in a day and making sure that each and every one of them is getting your complete focus and, when necessary, undivided attention for something that may or may not be new coming up or whatever. So that's where the malpractice comes from. It comes from, can't tell you how many times I hear somebody say, well, I don't normally do this, or usually it's this way, or my routine is commonly this. And for that one patient, you didn't do it.
Right? And then you say, well, I would have, or I did it, I just didn't write it down. But did you really do it?
Did you? Well, I mean, if it's not written down, it's not done when it comes to the legal world. So, and again, we get normally I write everything down, or I do this, or I do that, and I don't know what happened with this one. And it's like, well, if it happened with that one, which we just happen to catch or whatever, what is it? How many other times is it happening that you don't even know about?
So for those docs that are maybe thinking out there, well, I repeat myself because I see a certain type of patient, and that's, I'm an acute care practice or a specific condition or specific technique practice. So, for me, I'm not really repeating myself. I'm just repeating my technique. Like, how does this all fit in?
Well, to me, it comes down to intent. I don't care what you do, just do it with intention, and it will end up being the best that you can possibly offer that patient. So when that patient's down on the table, you've got to take a moment and have that awareness of your intent. When I got busier, and if I started falling behind, which happened, believe it or not.
No way.
Yeah,
You? Huh.
yeah, and I started falling behind, I moved more slowly. I didn't
Yeah.
move more quickly because I recognized that if I start doing things differently than what I did routinely, um, that's where mistakes happen. So I actually would take that moment before I walked into the next room and pause. I would open the door and stand at the door and look at the patient and pause. And these were the times I was behind instead of busting through the door like, a no-knock warrant coming
Right.
through there.
Yeah.
Don't stand on the other side of my doors. I'll send you into the other, across the room into the wall kind of thing. No, I actually slowed down.
Well, I think the patients appreciate that because they've waited to see you, right? And then if you're trying to
Mhm.
blow in and out of that visit, not only you may miss things, but also the patient's not gonna have that PTC moment and appreciate you, right?
And they
Like,
feel it. They feel your lack of intent because, they scheduled their appointment. They don't care how busy you are. They don't care what your goal is for seeing so many people that day. They don't care if you're tired. They don't care. They paid for the same service you gave patient number 1 at the beginning of the day. So, in their minds, if they're not getting it, why am I here?
and I think they appreciate it, like, let me talk about in my world of, experience, like, you go to a restaurant, it's cranking busy, right?
Mhm.
And you're hungry and your family's hungry, whoever you're with, and if the server is phoning it in because they're so busy, right? And they're blowing in and out of the table and forgetting things. You're not going to feel like that was good service, right?
Not at all.
Or on the flip side, because I used to work in restaurants and I'm conscious of and observe those things, I'm going to be more appreciative of the time they take knowing that in the back of their head they've got 4 orders to pull out and things to do and but they're spending that time with me, which is really nice,
And it's a skill. It's a skill to do, what you do, over and over and over again, and letting that person that you're doing it with feel like they're the only one. That's a skill. That's a skill you should work at, not fitting in as many people as you can in a small period of time, unless you can fit that many people in, and each and every one of them feels like they're your only patient. If they don't get that impression when they leave, then there's a piece missing, a big piece missing.
And what about the clinical interest, right? So, like, if you treated 10,000 patients the same way, aren't you really seeing one case 10,000
Exactly.
times,
Yeah.
right? I mean,
Yeah, and chiropractic works on so many levels. Yeah, just hitting them in the butt with a shovel, like, BJ said, will affect them positively in a sense most of the time. So we know that chiropractic works, and it works at so many different levels using so many different techniques. So you shouldn't allow yourself to accept that there's only one way or, in a sense, convince yourself that your way is the best way unless you've actually gone through the work with it. So sometimes you make decisions based on, many reasons. One of them could be this one's simpler. Great. If it's simpler and it's effective, that's a good thing. That's something you look for. If it's simpler, but in the back of your mind, you think there's something you could be doing for that patient that's better, that's not as good a reason for doing that. Because I think you should always seek to give every patient your best care.
yeah, and I just wonder, like, if there's docs out there saying, "Well, I do the same thing or basically the same thing again because that's my method, my technique, or my niche. What would you say to that doctor? Try to get them out of that sort of that habit or that routine, or interest them to get out of it. Because sometimes, you're looking at this saying, "Well, I'm doing these things because I know that it's going to work with the patient, but I also know I'm going to get paid well for it or better." You know?
Well, I look at it this way. It's kind of funny. If we get new patients every week, if we were 100% effective with every new patient that came into the office, very quickly, wouldn't be long before you just didn't have room to take anybody new. But the fact that there are patients that are leaving your practice for whatever reason, if you don't know what that reason is, or if they never tell you what that reason is, they just leave your practice, maybe it's because they didn't feel that intent. You don't know, right? They're not there. I used to have a practitioner that basically was one of those people that would adjust you. This is way, way back. He was actually my field doctor, right? Way, way back. He'd adjust you and say, give that a few days, see how it feels. If you think you need more, come back. And the patients may or may not come back. So eventually the patient did not come back. And in his mind, it's because he got them well.
Mm.
Do you really know that for sure? Could it be that that patient felt like, "Oh, I had my third adjustment and it didn't work, and obviously he thinks it should have. He keeps telling me that should do it, and since it didn't do it, I'm not coming back." And so in his mind, he was comfortable thinking everybody got well under my care, and there may have been a ton of people out there that didn't and never came back to tell him that. So if you if you have room to accept a new patient in your practice, then that means you have patients leaving you, and you should know those reasons. And if any of those reasons are because they never felt like they got everything they should get, then that's when you should sit down and have a little moment of introspection and say, "What can I do to make this better?"
It's funny. I'm thinking this example, chiropractic friend of mine, and his patient was moving. And so he called this chiropractor that was in the town that this patient was going to move to. He knew him and he said, "Hey, this patient, I've had a lot of success with these techniques and I've tried other things, but this is, what I recommend. This is going to be successful." And that patient went and saw that other chiropractor who did exactly what they do instead of what was recommended as what was effective. So gave a couple visits and left and came back and told, the original chiropractor they just didn't they just ignored the recommendations. And we're talking a very seasoned chiropractor,
Yeah,
like
this
you,
isn't
Mark, very seasoned chiropractor.
seasoned, spicy. I'd
Yeah.
rather use the word spicy.
Yeah.
You can
Yeah.
use seasoned, I'm gonna use
Yeah.
spicy.
Tough and salty, maybe. I don't know.
Yeah.
But I mean,
Well,
here it
that's
is.
the
Like,
whole point.
yeah.
Yeah.
Uh you got you either it's what you think you know better, or you don't want to take a professional recommendation. I don't really know what the motivation of that chiropractor was to not at least incorporate the recommendations into what they do. Instead, they just did what they do.
Yeah. I mean, if your routine is the end result of a very deliberate process of time and experience and practice, and you say, "This is what I do. This is what I've determined to be the best in the best way that I can. And it happens to allow me to see so many people a day." Great. As long as you deliver that service with the full focused intention, it's going to work and it's going to be effective and patients are going to love you and you'll be able to see as many people as you want to see in a day. But when you get a patient coming in saying, "Oh, I didn't like that doctor." I've actually had it both ways. I've had people that come in and told me, "Oh, I didn't like that doctor. I just felt like it was an assembly line." Okay, great. And then I had patients come in and say, "I didn't like that doctor. He just took too much time." to do what I know didn't require that much time. I was like, "Oh, all right, well," you have it there it is. It's both ways. You got people, complaining about both things, too much and too little. And to me, both of them were not happy for the same reasons. They just didn't feel the presence of that chiropractor in the moment that they were with them for whatever length of time they were with them.
And I wonder too, like, if you're present with that patient, you're going to make decisions that are relevant for that specific patient. Even if, let's say, you're complaining about something and the doctor's not letting you know that I know it's your shoulder, but I'm going to start with your neck, and the patient doesn't understand the connection, and they're like, why are they bothering with my neck? That's not my problem. But they're not taking the opportunity to educate the patient, let's say, on the clinical connections and the whole body experience, right? So
Exactly.
now you fall short of educating the patient on what chiropractic really can be, and then they're not going to say to you, they're just gonna think it and or review it that way
Yeah,
online,
I
right?
mean, if you're not doing anybody any favors if you have a good if they're only gonna get 10 adjustments in their whole lifetime. Truly. I don't care if those 10 adjustments relieved a condition that they had, but the focus is that sometimes I wonder if you have counter intention. What you intend is not what they intend. So, you have to take the moment to recognize that they may be there for a totally different reason than why you want them there. And you have to bring those 2 in alignment so that they feel what you want them to feel, and you feel what they want you to feel. And then you reconcile it. Like you said, "Oh, I'm gonna start adjusting your neck even though you're here with a right shoulder problem." Well, that person might need that moment of, "Well, this is the spine, this is what I do. The hip bone's connected to the knee bone," you know, right?
Yeah,
The hip bone is connected to the knee bone.
sure. You say so.
So just I think it's just that whole awareness thing that you can do anything you want. You can do as much of it as you want, as long as it's done with the full intention that what you're offering that patient is the best you can offer it. Treat them like you would treat your spouse. Treat them like you would treat your parents, your brothers, your sisters, people you care about.
Or maybe not, I don't know. Depends.
I wasn't gonna nah. Right.
Ah,
Right. Let me rephrase that. Treat them like the people you love most on this earth.
yeah, right. Yeah. Again,
Yeah.
I don't know.
Yeah. They shouldn't be getting anything less than that. And the people you love most on this earth shouldn't be getting anything less than what you give your patients.
Now what about the let's say the newer docs in town? They graduated, they're out for a little bit. They're really just feeling their clinical way, and maybe routine and their method is, you know, is building confidence and comfort for them. Now, how do you translate that to saying, "Well, don't stay inside the box for so long," you know?
Well, yeah, I would think somewhere along the line, they should come out of school at that point with some intellectual curiosity. Um, and
Fear,
and if they
curiosity.
really do think they have all the answers, then they're going to have a tough time in practice because truly the old saying, the more I know I don't know is true. So they have a nice place to start and build and be curious. Talk to other chiropractors. We've said this, you've said this many times, why won't we talk to each other about what we do and why we do it? It's one thing to talk about practice protocols and procedures, and that's great because we're also a business. We say that a million times. You're also a business. But as a chiropractor, you should be talking to other chiropractors about chiropractic.
I think so too. I think that helps explore your clinical, curiosity as well as just your professional colleagues in that vein too. I don't know, there's such a disconnect from our generations to the ones coming up because they don't connect in the same way and we don't
No.
understand that. So are they connecting? Maybe, maybe it's by proxy through these social media pages and groups and things like that.
Have reasons for everything you do. Don't just take it on faith. Have reasons. When I was in school, I have said this before that, I actually was a supervisor in the Gonstead section of the clinic.
Oh, Mr.
But
Big
I'm
Shot,
not a
excuse me for living.
oh, we all did, right?
Yeah.
But I'm not vertically excessive here. I have my vertical
I'm
challenge.
sorry, I don't understand what you're trying to say. Could you?
Yeah, I'm not that tall. So, I recognize very early on at that point, no matter how low I make that pelvic bench, this is not going to be an easy technique for me. As much as I loved it, I thought it was great. It was not going to be an easy technique for me. So I made conscious decisions to pursue and investigate and determine that there are other techniques that were more conducive for me, knowing that I want to do this for a very long time and not
Mhm.
hurt my shoulder, not hurt my back. And we know that as chiropractors that it's very common to end up on disabilities because of your shoulder and doing the side posture work or whatever. So just be conscious about what you do and why you do it.
Stephen Hawking has a saying, "The greatest enemy of knowledge is not ignorance, it is the illusion of knowledge."
Exactly.
I'm not
Isn't that what
staring
you
at
were
you
just
for any
saying?
reason.
I know. Isn't that what you were just saying about kids coming out of school? They just spent 3 to 4 years being told everything they need to know, and they've spent a small fortune to get there. They wanna come out thinking that they're there, and they are, to a point. But what we're saying is go further, investigate, learn,
Yeah.
ha be focused with your patients. You don't know everything. I don't know everything. You definitely don't know everything.
How dare you? Well, and give yourself permission to know that you don't have to know everything,
Mhm.
but be curious to wanna learn more and change up what you're doing as you refine. These continuing education classes we always talk about live is dead in a sense. People don't come out. Um, and I hope that pendulum switch changes the other way again because it's to me on a hands-on profession like chiropractic or massage or physical therapy or whatever. How do you learn or get better at techniques if you're not practicing and having experienced, teachers guiding you?
Yeah, and talking with other doctors, that everybody has something to offer, and very often, if you were to sit around and have nice discussions with other chiropractors, you can go back to practice and do something that little bit differently than what you were doing before you talked to them because you just got that little pearl or whatever. And sometimes those pearls are a better way to see more people and not take as much time to accomplish the clinical outcome to its max. And that's what we're talking about is it's okay to spend all day treating a gazillion people if you want to treat a gazillion people a day, as long as every one of those people and if every one of them that comes into your office gets the same great adjustment and with the same expectation and with the same intent. So
And specific to them, right?
yeah, drop mic.
Yeah. Well, I guess we've said it all then, haven't we, Doc?
That's it.
Yeah. Well, thank you again for joining us for another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini. Thank you all.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.